I'm DeAnne Seekins. I'm the Network Director for Vision 6, and I'm really pleased to be here today. What I want to do is just give you an overview of our network, and then I want to talk about some of the initiatives and some of the things I believe that we will partner together with the work group. And we cover all of North Carolina and all of Virginia, and we have 7 medical centers and 35 other sites of care. North Carolina is a very much a desired state for folks to come back and retire or to relocate. So we have been very fortunate after 5 years of just getting all the support we can possibly get behind us. We are going to be building a new clinic in the Raleigh area. So it'll be called a healthcare center. What the difference is with a healthcare center is it's kind of like a super outpatient clinic. It will house many services except for inpatient beds. So we'll do procedures there, we'll have specialty services, primary care, integrated mental health, and just a lot of things under one roof. It'll be almost 200,000 square feet of usable space. So we're really excited. We're on the fast track, and we hope to begin construction next year. So greater choice for veterans is definitely one of the Secretary's top priorities, which when it's his priority, it also gets the energy and what we need behind it to support that. So we have made a lot of progress with care in the community, care coordination, and working with our veterans to ensure that they have greater choice. I see a lot of future initiatives that we're working on that are going to be even more beneficial to our veterans. Next, we have focus resources more efficiently. I see that really hand in hand with modernization. You know, when we talk about modernization, we also talk about having services for veterans available to them in their homes. And that's beyond the healthcare provider or the home-based primary care team actually going into their home. But it's talking about that they can have telehealth. We now have what's called VA Connect. So our providers have access from their iPhones to have iPhone connection with their patients in their homes. So we're really moving more towards that. We have done a great job with telehealth, where patients and veterans will come to the clinics and they may be able to see a specialist at Durham VA Medical Center and they're sitting in Salisbury, or they're sitting at Morehead City. We really want to move that even closer to the veteran and see what can we do, how can we service that veteran at home. So we look forward to that initiative. Timeliness of services. I know that there's not a person in this room who hasn't heard the word access. If you haven't, we can talk afterwards, but it's definitely been a topic for many. Access at times is a challenge, and we have many veterans, as I said, moving to the area, coming to the medical center. In 2014, when the media kind of went crazy over, I always say I'm not going to mention that poor facility because it gets mentioned so many times, but it kind of took national life on. And do you know that our veterans, we went from, I can speak at the Durham VA, about 700 new patients a month to 1,000. So the veterans really spoke up to me and said, you know what, we want this service. And so we're coming forward, and that's continued. This is a listing of some of the clinics that are either getting ready to open or have opened. I talked about the Raleigh Healthcare Center. We also have a replacement clinic in Rutherford. Morehead City down on the beach, we're out for solicitation for a new clinic there. Jacksonville has exploded, and so we are looking at new clinics and possibly at HCC in that area as well, and then Brunswick.